My research topic is nanotechnology in early cancer detection and treatment, and my name is Lakshmi Trivedi, and I'm a sophomore at Westwood High School in Austin, Texas. So to start off, what is cancer? It's a disease in which some cells grow quicker at a very quick rate and spread across the entire body. And the most common treatment for cancer is chemotherapy, which is very like physically and mentally hard on the patient, and it um, causes hair loss and constant fatigue, changes in mood and memory loss, and also even after chemotherapy, like side effects such as long-term damage to the liver, heart, or lungs can occur. So in my research paper, I specifically focused on breast cancer, and breast cancer is found all over the world, and it is mostly found in women, but men can be diagnosed with it too. Basically, anyone that has breast tissue. And African American women have a higher death rate due to a triple negative diagnosis, which is something I'm going to get into later in my presentation. So for the gap in knowledge, so like today's imaging techniques to cancer treatment, like the most common ones are MRI, CT scans, or X-rays. They are like they detect cancer at later stages, and these methods can result in a false positive or negative result, which is obviously very critical for the patient. And also there are biopsies, which are invasive procedures which can be uncomfortable or risky for patients. So nanotechnology is a good alternative option for when it comes to cancer treatment and detection. So what is nanotechnology? It's a pretty recent development in modern medicine. It's about a little less than 40 years old, but it's it has nanoparticles which are 100 to 10,000 times smaller than the human cell, and because of how small they are, they contain unique physical properties which help them in um, like detection and treatment. So current treatments in nanotechnology include like surgery or like biopsies. No, actually no, surgery, and then like radiation therapies, hormone therapy, chemotherapy, immunotherapy, HER2 targeted therapies, CDK inhibitors, and there's also nanotechnology, which only target the cancer biomarker, like the tumor, and they have a minimal effect on surrounding tissue. And these nanoparticles deliver chemotherapy to just the tumor cells. And there are like a lot of different kinds of nanotechnology that has been used in like clinical trials and preclinical trials. So there's different types of breast cancer, which are like luminal A, luminal B, HER2 positive, and triple negative. And symptoms include like unknown lump in breast or underarm, or thickening or swelling of the breast, etc. And the causes are a genetic mutation of BRCA1 or BRCA2, which increases the risk of getting breast cancer by 60%, and also family history and like genetics, and sedentary lifestyle and obesity. So over here I have my preclinical trials. And so I basically I made a table about like um, the type of breast cancer and the type of nanotechnology used, whether it detects a biomarker or pathway, and if it's like a therapy or detection. And over here I have my clinical trials, and it's basically the same thing but for clinical trials. And these are I made this image using biorender, and these are like the current detection techniques. So we have like microRNA and ultrasound and the mammograph and um, MRI. And this is the nano enabled biosensor, which like I kind of put it inside over here so you can like see that it really affects like just the tumor or the biomarker. So for my methodology and results, I used many articles across the internet and preclinical/clinical trials found on PubMed and clinical trials, and like clinical trials the website, and combined them to formulate my review article. And for my results, I said that nanotechnology plays a major role in fighting breast cancer and enables new ways of detection and treatment that are more precise than ever. Innovations such as nanoscale materials and devices now enable researchers to spot cancer at times much earlier than before, and such an improvement in diagnostic capability helps in developing treatments. And for my conclusion, so for my research question, I said, can nanotechnology aid in the early detection and effective treatment of breast cancer? And for the contribution, I said that nanotechnology provides new ways of detection and treatment that are more precise than ever, and are able to spot cancer at earlier stages. And overall, nanotechnology opens up new horizons in the field of detection and treatment in breast cancer. And tumor imaging with the use of nanoparticles has changed many of our conventional understandings of tumor behavior and quick responsiveness by doctors. And yeah, for the treatment aspect, nanotechnology has come up with very promising methods in targeting directly cancer cells without harming healthy tissue. And yeah.
Amazing. Very nice. The fact that you drew your own biorender pictures and everything. I mean, it shows the level of detail and effort that you put in the research. A big round of applause to you and everyone else who learned biorender and put it in their pictures. A question for her, Dr. Prala.
Yeah, great job, Lakshmi. Good presentation. So we couldn't see the table very well. I kind of know, but for others, can you just say, did you find any clinical studies using like nano particles for early detection? How is it being used? Is it already there?
Oh, so wait, do you want me to show the
No,
table again?
just mention it. That's you can just
Oh,
mention it. Yeah.
yeah. So
What did you find?
basically, like there were some preclinical studies, such as like in Brazil, they um were exploring how like bifunctional nanoprobes that are combined with photodynamic therapies can uh, be used for triple negative breast cancer treatment. And so that's like an example of a preclinical study that was mentioned in my paper. And then also for an example of a clinical study was like in um, a when in a specific medical center, they used nano, I think it was nanocarbon, nanotechnology, and they used it to explore triple negative breast cancer treatments.
Yeah, excellent. Yeah, thank you. Great presentation. Congratulations.
Okay, great job.